My name is Mili Doshi. I'm the clinical lead for Mouthcare Matters, an initiative that is being rolled out to every acute trust in Kent, Surrey and Sussex this year. The aim of this short presentation is to demonstrate the positive impact Mouthcare Matters can make to inpatient care and the importance of support from each trust. Mouthcare Matters is funded by Health Education England, and the aim is to improve the oral health of hospitalised patients. At East Surrey Hospital, we have created a model that can be taken and adapted for any acute or community setting. At East Surrey Hospital, the pilot site, by improving mouthcare and oral health, we have improved compassion and dignity by providing patients with the assistance with mouthcare if they need it. Safety through looking in the mouth. Nutrition, a pain-free or comfortable mouth will make it easier to eat and drink. Rates of hospital-acquired infection. By removing bacterial plaque, we'll be reducing the incidence of hospital-acquired infections. All the above will help to reduce hospital stays. What is mouthcare like for inpatients, many of whom cannot get, for whatever reason, out of their bed and walk to a bathroom and clean their mouths or dentures? In many hospitals, mouthcare relies on using a piece of foam stuck to a stick that effectively does nothing. Nursing staff often have no training in mouthcare. How can we expect our nursing assistants to clean dentures if nobody has ever shown them how to remove them from a mouth? The link between poor oral health and general health is not known by nurses and doctors. Mouthcare and mouth assessments are often not recorded. Our audit showed that there was recording of 0% of mouthcare in medical wards. The failure to provide mouthcare is neglect. Often, vulnerable older groups of patients can go days and sometimes weeks before anybody thinks about cleaning their mouths and dentures. Mouthcare is also very important for end-of-life and nil-by-mouth patients. At East Surrey Hospital, the CQC picked up on dry mouths on the wards and advised that the hospital needed to review mouthcare. These are photographs of our patients that show how oral health can deteriorate in hospitals. The lack of training and knowledge of hospital staff has led to patients with mouths so dry their tongues are stuck to the roof of their mouths, teeth that are not brushed for days, mould growing on dentures, and no treatment for people with sore mouths or dental pain. From our literature and networking, these problems are not unique to our hospital, and there will be mouths like this in all hospitals. It is time to do something about it. Our mouth is the gateway to our body. If we have eye problems, we may have problems with our vision. If we have problems with our mouths, we will have problems eating or drinking. Every day, we see patients who have sore, dry mouths, sharp or loose teeth, or missing dentures. All of these problems will impact on the ability to eat and drink. On average, our mouthcare team and dental team see 50 patients a month with oral health-related problems. The failure to provide mouthcare will lead to an accumulation of plaque that contains millions of bacteria. This plaque can be aspirated and potentially cause pneumonia. If patients are struggling to eat or drink or have hospital-acquired infections, it will impact on recovery and make them frailer long-term. This will increase care costs either as patients stay in hospital longer or are increasingly dependent when they are discharged. How can we improve things? Mouthcare Matters is based on 4 simple principles. By providing training, we will provide staff with the knowledge of why mouthcare is so important. We'll also ensure that nurses have the skills to provide basic mouthcare to vulnerable patients. Making sure that patients have access to mouthcare products such as toothbrushes, toothpaste, dry mouth gels and denture pots to help reduce the number of lost dentures. And support when needed from doctors or a dental team. To make Mouthcare Matters work in other trusts, we need a lead nurse in each trust who can work with us at SASH to deliver training predominantly on the wards and in small groups. This is an opportunity for someone who has a passion for improving mouthcare to form a network with nurses, doctors, the SALT team, pharmacy and dietetics and work together to improve the oral health of our hospitalised patients. All the training and resources will be provided, and a Kent, Surrey and Sussex mouthcare network will be formed. At SASH, we have had a mouthcare team for 7 months, and they are an important part of our inpatient care. We have already made a lot of improvements in mouthcare. There has been a 66% improvement in the recording of mouthcare. Mouthcare training is now mandatory at SASH for all staff. We have identified serious safety issues and are working to address these issues. Patients, carers and staff are very positive about the initiative. Michael Wilson, our Chief Executive, is happy to continue to fund this as a permanent post. Failure to address mouthcare can be serious. This was a patient who spent 2 weeks on one of our wards with a tumour the size of a golf ball in her mouth because no one looked. Mouthcare Matters is a positive step forwards. We still have a lot of work to do, including raising the profile of oral health and the relationship to general health. We often get asked if mouthcare is just common sense. No, otherwise it would have been addressed. Washing hands is common sense, but we still needed a campaign to do it, and it has made a significant difference to healthcare. How can you support the rollout of Mouthcare Matters? There is Health Education England funding for each trust. Please raise and maintain a high profile of Mouthcare Matters in your trust and help us to second the right person to be the Mouthcare lead. Thank you very much for listening.